Hi, welcome to our podcast. I'm Rob Stevens, one of the consultants in anaesthesia at UCL hospitals. It's hard for trainees to decide what speciality to do, so we decided to interview some trainees in anaesthesia to find out what life was really like for them.
So I chose anaesthetics because it's a specialty that gets to involve itself with all the other specialties, so I like a mixture of things, and anaesthetics provides that. So you get to work with the medics and the surgeons in obstetrics, in A&E, and generally you get to deal with the slightly more interesting, slightly more unwell patients, which is something that I enjoy doing.
So I stumbled into anaesthetics blindly, mainly because people in anaesthetics seemed really happy in their work and seemed to really enjoy their jobs. And when I was doing my surgical attachments in anaesthetics when I was a medical student, I found myself just drifting up to the top end to question the anaesthetist on physiology and pharmacology. And they always had time to teach me, and I thought, actually I really want to be like that. So that's the kind of doctor I want to be, somebody who has time to teach their juniors and knows their stuff inside and out.
I like the mixture. I like the mixture of the practical and the theoretical and the thinking, and I also like the mixture between the sort of high tempo environment. For example, when you're in resus and A&E and you've got very, very unwell patients where you're sort of thrust into a very fast moving situation, but then also you still have a little bit of time where it's not quite as high tempo and it's a bit more relaxed, and I think that gives you quite a good balance in your life.
So there's quite a lot of different areas that you learn along the way and different areas that you can subspecialise in. I really enjoy the practical side of things, and another thing I quite enjoy is the fact that when you're with a patient, you're completely with them, so you're not running around trying to look after hundreds of patients at the same time. And as I mentioned, just the training is really fantastic, and you also really apply your basic knowledge to what you do every day.
I actually quite enjoy in trying to explain medical concepts in a language that anyone can understand, even under a pressured and difficult environment.
It's difficult to get bored in anaesthesia, and it's a career that you can make into whatever you want it to be. So I've flown in private jets and helicopters to retrieve patients. My colleagues have climbed mountains and done expeditions and gone to the furthest reaches of Africa or Third World to deliver training and care to people who need it the most. It's one of those amazing specialties that allows you to do anything and allows you to travel.
I think probably the knowledge that every day of your life you stop someone breathing, and the potential for disaster and the potential for massive impact on somebody's life was there. And I think initially, when you're in your early stages of training, I struggled a little bit with that concept and the responsibility that came with it. And I suppose as you move through, you become better skilled, and therefore that responsibility is still a relatively heavy burden, but you feel you're skilled more to deal with that.
I think the hardest thing that I found with anaesthetics is that on the rare occasion where things go wrong, they do go wrong very quickly, and so you have to be good at managing yourself and others in emergencies. And an element of that, particularly I think as a trainee, is recognising there is something that needs treating quickly, and also knowing how to treat it. That's something that I think has taken a bit of time and obviously a bit of practice and experience.
The difficulty is sometimes as trainees you work with different anaesthetic colleagues, but you also work with different surgeons as well. Quite different from being a consultant, because consultants tend to work with do the same list every week, so they get to know the team very well and how the surgeons operate. But as trainees, we don't work with same surgeons all the time, so it's sometimes very hard to plan in terms of your anaesthetic and how this patient would behave.
Anaesthetic training, you're very supernumerary, which is different because you're used to working on your own on the wards. So having to put drips in with the consultant standing over you is a new experience, and not really being able to do much on your own at all is difficult to begin with, but you soon get into it and you soon kind of develop and be able to work independently.
I think that it's very, very different from any sort of other aspect of medicine, and I think when you first start working, it takes a bit of time for you to get used to the whole environment. But then after a couple of years, you've worked in various places, medicine, surgery, accident and emergency, and you start to become quite comfortable and you think that actually, you know what, I know what I'm doing. And then you go to anaesthetics and it's completely different, and you basically go all the way back to being, you know, a glorified medical student. And I think that's quite hard to take for people when you're starting to feel like you're getting more confident, you're more grown up, and then suddenly you go right back to square one. But after a couple of months, things start to make a bit more sense. You start to get a bit more responsibility, and then you get to sort of grow into the role a little bit.
I think you don't realise as a medical student how important an anaesthetist is to pretty much everything that happens in the hospital, in theatres, on the intensive care, in A&E, on the medical wards. We're kind of key to every sort of involved process. And we're also the person that takes the patients and manages the patients that everyone else has kind of exhausted their limits of treatment with. So we're kind of we're the end of the line, and so I didn't realise just how important our role is in patient management.
It's just brilliant. I suppose when I first started as a junior doctor, I had that real Sunday evening feeling I've got to go to work, and a slight dread, and I just don't have that anymore. Anaesthetics is just a really good, fun place to come and work, and I love my job, and I suppose that's something I don't think I could say when I first qualified, but I do now, and I really actively enjoy what I do.
I hadn't realised how much I liked talking to patients. So putting them to sleep is something which I enjoy, but it's something that I find I kind of wish they were awake more. So there's an element of not boredom, but there's not a lot of patient interaction. You see them for an hour in the morning and then a couple of minutes before you put them off to sleep. And aside from that, you don't get to talk to them a great deal. There are aspects of anaesthetics where you do get to do that, so obstetrics and some regional work, but that is the one thing I miss.
I think, although I love anaesthetics, I appreciate it's a speciality that some people really, really take to, but a very few people don't like it, and I know a few colleagues who've gone into anaesthetics and after a year dropped out. So I think take whatever opportunity you can to come into theatre and join us. We're all generally, by and large, a very accommodating group of people who like having a medical students around and showing them what we do, and also getting them involved. So in your taster weeks, when you have sort of spare time in the day, come to theatre and see what it's all about.
I would say just enjoy what you're doing, make the most of every job or every rotation that you're in, and that there's always time to change, so you don't have to stick to one career, but there's always scope to change from career to career, really. So don't decide early on what you want to do and feel you have to stay with that. You can always change what you want to do.
My advice that I would give is try do some anaesthetics. I think the first impression is that maybe it's a little bit dull. That's completely wrong. It's not dull. It's a really amazing career. Most of the time it's very chilled, but underneath the surface we're always thinking. We're always prepared for the worst situation, and so if you're making it look dull, then you're actually doing a really good job, because it's actually a very difficult job, and when things really go bad, the first person you want there is the anaesthetist, and that's a great thing, I think.
I think sometimes you can get the misunderstanding that an anaesthetics job is quite boring, that you just sit in surgery while the surgeon does all the interesting things. So I think you need to kind of really follow the anaesthetists around the hospital, to do the preoperative assessment of a patient, all the intraoperative things that an anaesthetist does, but also follow anaesthetists to A&E and see what they do down in A&E, and also see what they do in ITU. I'm a dual anaesthetic and ITU trainee, and I think they complement each other really well. And even if you don't specialise in ITU, a lot of anaesthetists during their training spend a lot of time on ICU. So again, it's just another part of the skills that an anaesthetist needs to learn.
Varied.
Cooking.
Interesting / challenging.
Rewarding.
Very fantastic.
Fun.
Stratospheric.
Enjoyable.
Fun.
Divine.
Hi, thank you for listening to our podcast. If you want to find out more, I would go to speak to an anaesthetist in your own hospital or explore the links in the previous slide. Good luck.